Well, good afternoon, everybody. Welcome. Thank you for giving me this opportunity to come and talk to you today. My name is Greg Carter, and I am the program director out at Tacoma Community College for the Respiratory Care program. What I would like to do for the next 20 to 30 minutes is talk about a field that has been really good to me and one that I've enjoyed for the past 30 years, and that is respiratory therapy. Not a lot of people know what respiratory therapy or what respiratory therapists do. When they think healthcare, they usually think physicians and they think nursing. But there are so many more opportunities in working in healthcare. And so I would like to give you a little bit of insight on what respiratory therapists do today. So sit back and enjoy, and if you have questions, I would be more than happy to answer those at the end of this discussion. So for today's lecture, let me just first go over a couple objectives with you that I hope to accomplish with you today. First of all, I'm hoping that you walk away having an understanding of what respiratory therapists do. Understand that there's more than just nursing and physicians working in healthcare, primarily with patient care. Also, I want you to determine if this may be a career for you. Understand that it's an option if you're interested in patient care, especially if you want to get into the acute care setting. And last but not least, I want you to have an understanding of what it takes to become a respiratory therapist, in case you're interested. So what I'd like to do now is get some perspectives on what it's like to be a respiratory therapist. So what do RTs do in a day in the life of an RT?
I'm a respiratory therapist.
I am a respiratory therapist.
I'm a respiratory therapist, and I save lives.
A respiratory therapist is a professional who has been trained to work with patients who are affected with chronic lung disease across the spectrum.
So anything that affects your breathing, a respiratory therapist is likely going to be involved in the care of that patient.
A respiratory therapist is not only a therapist, but a practitioner. We help patients in so many different capacities, not only with breathing, but with education, with lifestyle. So we have many different roles throughout healthcare. It can involve working in a hospital such as the ICU, a neonatal ICU. We can work in the emergency department. We can work in diagnostics and therapeutics. We do outpatient education. We do smoking cessation, asthma education. We work in pediatrics. So, a respiratory therapist, we hold so many different roles that really help the community in so many different ways.
I'm a respiratory therapist.
I'm a respiratory therapist, and I care for my patients breath by breath.
The thing I like most about it is the variety of the day and the variety of the career. In the hospital I'm at, we have neonates all the way up to adults. We have a burn ICU, trauma ICU, so we can be anywhere at any time of the day.
There is always a patient that needs something unique. Sometimes there are physicians that have different needs that we have to take care of.
Obviously, it starts off finding out where I'm at, where I'm assigned to, getting a report from the night shift, seeing what the plan is for the patients, and then going to see every patient, doing rounds.
I work in pediatrics, so I may get 5 patients, may get 6 patients, but they're patients that need help with breathing, and my job is to provide them with their treatments. A typical day would be going from giving a treatment to maybe a 5 or 6-year-old that's slightly sick, then going into an intensive care unit, somebody that's much more ill, and every decision that I make on how to set that life support machine could affect their outcome.
We have so many different pieces of equipment, and they all do so many different things, from a wide variety of life support equipment to sustaining equipment to equipment that just will deliver oxygen.
So a typical day is checking equipment, getting with our people. We also will go in-house and check on the therapists in-house and see if they need anything. But primarily, we're waiting for calls and they come. We usually do 2 to 4 transports a night, and they can be anywhere from 2 or 3 hours long to 6 hours long, or sometimes even beyond the shift.
We see each patient anywhere from 1 time a day to 6 times a day, depending on the type of patient.
Day will typically end right about 5, 6 o'clock in the evening, so about 12-hour days. I'm a respiratory therapist.
I'm a respiratory therapist, and I love taking care of people.
I worked in a teaching hospital, so it was routine that we always had students, following us. Precepting students was one of our responsibilities. So that's how I got into education. I became a clinical instructor. That also opened another door for me when a program director position became available.
Empowering the patient to manage their chronic lung disease so that they understand that they can live a good life. It's about quality of life, so I feel that if I can help teach them on how to handle their chronic lung disease, it's about having the confidence that they're going to be okay.
The education and dealing with the patients, it's very satisfying to me. You go in a room with someone you haven't seen in a while, but they look at you, the family looks at you, and they remember you, and they're happy to see you, and that makes my day.
So obviously, you've probably seen us on the news. If you've been watching the news or the newspaper, we've been in the headlines. Obviously, we're in this horrible pandemic of COVID-19, and respiratory therapists have been on the news. They've been in magazines. They've been on TV shows fighting the battle of COVID. One of the things that you heard in the video is life support systems. Respiratory therapists deal with patients who need help breathing. We breathe for people. And obviously, breathing is a very, very important thing. We maintain the airways, and with COVID-19, we're playing a vital role in these patients who are coming into the hospital who are in some sort of respiratory distress. Now, not only COVID-19 is not the only pandemic we've seen. We've seen polio up here in the upper left-hand corner. You see people in iron lungs. Respiratory therapists took care of those people. We had the H1N1, H1N2, the Ebola virus. Unfortunately, COVID-19 probably won't be our last pandemic. History tells us, these occur about every 30 years or so. And so you can guarantee respiratory therapists will be working on the front lines. Other things patients that we see, chronic obstructive pulmonary disease, patients with heart disease. COPD is the 4th leading cause of death in the world. And patients who have emphysema, chronic bronchitis, need our help. They come to the hospital looking to help for their breathing, and respiratory therapists are the ones who take care of them. Oftentimes, some of these chronic lung conditions are caused by smoking. And, we need smoking cessation classes for our patients. Some of you may have asthma or know somebody who has asthma. It's estimated that 1 in 5 Americans are diagnosed with some type of allergic asthma, and we are the profession who work with these folks day in and day out. So what are some of the job duties of respiratory therapists, and what are some of the skills required for becoming a respiratory therapist? So what do RTs do? Well, we do things like develop and implement effective care plans. We apply patient-driven protocols to take care of our patients. So having a knowledge on how to read algorithms, decision trees. We utilize disease-based clinical pathways. So having an understanding of the different pathology that patients may have, or the different disease states that patients may have. And we also implement disease management programs. Medicine is more proactive today than it has ever been. And so we try to keep patients out of the hospital by educating them on their disease, such as patients with asthma, as well as COPD. And of course, we perform bedside therapeutic and diagnostic procedures. So respiratory therapists must be able to apply good critical thinking, patient environment assessment skills, and evidence-based clinical skills. And so to do this, we must have an in-depth knowledge of the cardiopulmonary physiology and pathophysiology. We must have excellent patient assessment and diagnostic skills. We must have knowledge in pulmonary disease, as well as advanced life support and critical care. Also, knowledge of biomedical engineering and technology is important. So there's quite a bit of in-depth knowledge that is needed to become a respiratory therapist. Now, I don't want that to hinder you or intimidate you, because a lot of these skills are learned in a respiratory care program. So why did I choose respiratory therapy? Well, this is a picture of me 30 years ago, believe it or not, back when I had hair when it was dark. To make a long story short, I got into respiratory therapy after going to Pacific Lutheran University in Tacoma. I received an exercise physiology degree. My intent with that degree was to do some sort of cardiopulmonary rehab. I was very into diagnostic testing for lung volumes, essentially doing pulmonary function testing. And I found out what I really wanted to do was in the acute care setting in the hospital. And I found out most of those jobs were being done by respiratory therapists. So after doing some research, I went from PLU to a local school and enrolled in a respiratory care program and fell in love. I worked at Harborview Medical Center for about 10 years doing adult critical care, did some research, was published in some major medical journals, and for the last 20 years, I've been teaching at Tacoma Community College. Part of my job at Harborview Medical Center, because it's associated with the University of Washington Medical School, we would take students around clinically. We would teach medical students, medical residents, nursing students, respiratory students, and, took around high school students who were job shadowing. And so kind of, put the two together, respiratory therapy and education, and here I am. So let's listen to a few other respiratory therapists to find out how did they get into respiratory therapy.
Well, it was actually 93. My mom was in the hospital, just had some surgery. So I was able to see the respiratory therapist kind of in action, so to speak.
The respiratory therapists at the hospital that I worked at were just fantastic. Everybody respected them. They had lots of autonomy. When an RT showed up on the unit, people listened to what they said.
I was inspired at a very young age because I was always in the hospital for recurrent pneumonias, even as a baby. And once I was able to get that under control, I wanted to do something to help patients with my same issues.
I don't have the typical go to high school, go to college career path. 8 days into my senior year, I had a motor vehicle accident, and I spent about 6 months in the hospital straight without leaving. And the people that I bonded most closely with inside the hospital were my respiratory therapist. As a 17-year-old kid, they seemed the coolest. So I was like, well, what does it take to be a respiratory therapist? I didn't know anything at that point. And so I started looking in, I started doing some research, and it really sparked my interest because I'm like, this is achievable for me. Like, I can do this.
During my mother's first open heart surgery, I watched her on a ventilator, and I was clueless, and it really interested me. And so, that's kind of what brought me into the profession, and just to make that patient experience better, not only for her, but because that's where it started, but for every patient.
So, is respiratory care right for you? And some things to think about. I'll list some things that are unique to respiratory therapy, and you can kind of decide if this is going to be a fit for you. So a career as a respiratory therapist can provide the ability to make a difference in people's lives. It's interesting and meaningful work, always changing. Every day is a little bit different. Working with the various disease states and injuries that patients may have, it's very, very challenging, which is one of the reasons why I've enjoyed it so much. It's not the same old every single day. Each day brings new opportunities and different situations. I like to deal with high tech, dealing with the different ventilators and different equipment that we use. So you have to be a little bit tech savvy. And that brings some excitement into the field of respiratory therapy. It's a very people-oriented profession. Not only working with patients, but you're working with other people on the healthcare team, whether it's a physician, a nurse, a radiologist, and dealing with patients' family members, consoling them, educating them about their loved ones' issues. It's also an opportunity to help others and have an impact on somebody else's life besides your own. And it's an opportunity to become a respected member of the healthcare profession. Obviously, I showed you some videos, especially now with COVID-19, respiratory therapists, are becoming more known because we're on the news, we're on the magazines, we're on TV shows. And so we do get recognition, and it's respect and appreciation, not only from our patients, but also from our other medical team. Job security, it's great. I can't say enough about the job security or the salary. It's given me a good life as well as my family. I wouldn't have been in this field for 30 years if not. And according to the U.S. Bureau of Labor Statistics, employment for respiratory therapists is projected to grow to about 23% from 2016 to 2026. And that's much faster than the average for all occupations. And there's many reasons behind that, mainly because people are living longer and getting chronic lung conditions just through old age. And also people are starting to retire off in the field of respiratory therapy. We were in a recession a couple years ago to where therapists couldn't retire. And now that's not the case, and people are retiring. And of course, working this pandemic has increased the workload for respiratory therapists to where we need more. So let's look into some more reasons why people think respiratory care is good for them. So here's another video.
So I think from a career choice standpoint, there are lots of options when you get into respiratory care. You can work in the hospital, you can work in the home care setting, you can work for a medical device company like I do and travel all around. There's a lot of options.
In the 34 years that I've been a respiratory therapist, I've been able to travel anywhere I wanted to, partially because of building up the resume, but also because of the respiratory therapy is needed everywhere, and if you have a good background, you're going to be able to get a job pretty much anywhere you wanted to.
They're always going to need respiratory therapists. There's always going to be, people that smoke, people that have heart disease. Now with vaping, obviously that's in the news.
And I have never felt that I have to worry about whether or not I'm going to have a job. Many times I have to battle and decide which job I was going to take because there were many offers on the table.
As folks are moving up and doing different things in their career, so that leaves more opportunities for others to come in and fill those spots.
I mean, I see it as a great career choice moving forward because there's plenty of opportunity, and it's not a career that would ever get old.
If you're looking for a field that evolves with time, being a therapist is probably a good fit for you.
Respiratory therapy is a solid career choice because the profession, will always be here, and it's forever changing, forever growing, and there are so many different opportunities.
So let's talk a little bit about what it takes to be a respiratory therapist. And this is my team. I've got Kelly on the left, Brandon in the middle, and myself on the right. But I want to talk a little bit about respiratory therapy and how to get into a program. And if you're starting to think this may be something that you're interested in, what are the steps that you should be taking? And so, a common question that I would get is, when should I start thinking about a career in respiratory therapy? It's never too late. In fact, I would tell you sooner the better. What you can be doing is, visiting with respiratory faculty. You can go, talk to your guidance counselors to try to find out, where are the respiratory care programs. Like I said, there's 4 in the state of Washington. There's Seattle Central, Highline, Spokane, as well as Tacoma Community College. Take some aptitude tests. See if you have some of the skills that it takes, the critical thinking, analytical skills that is needed to be an exceptional respiratory therapist. Go to career fairs, talk to employers, talk to respiratory therapists that are in the field. Attend information sessions. Tacoma Community Colleges have, I think 1 or 2 information sessions per quarter. You can sign up for those on our Allied Health website, on our college's website, as well as the respiratory site at Tacoma Community College also has a virtual information session that kind of talks about the field and the steps to take. And I'd also encourage you to visit the AARC website, aarc.org. There's tons of information about the career. There's tons of information about education. Do your homework. You want to invest in something that you will enjoy. Respiratory care program at TCC is a 2-year program. Curriculum includes things like general education courses, such as communication, English, and math. Those are usually done prior to coming into the program. Science courses. Students need to take chemistry, biology, and biology A and P. Those courses are mandatory for enrollment into the program. And obviously when you get into the program, there's, the theory courses, laboratory, simulation, and clinical courses students must take. So respiratory therapists, in short, they make a difference. And you can too. If you'd like more information, please reach out to me. My name's Greg Carter, and you can reach out to me through my emails, probably the best way since we're virtual right now. And that is gcarter@tacomacommunitycollege.edu. Once again, that's gcarter@tacomacommunitycollege or tacomacc.edu. And I'd like to thank you for listening and taking time to learn about respiratory therapists. I would also like to take this time to thank many of the respiratory therapists that were interviewed to make this video, as well as my respiratory students. They weren't too excited about videotaping in the classroom during skills, but they're heroes, right? They did a great job. And one of the things about respiratory therapists is that you always have to work under pressure, and they certainly did with the bright lights and the cameras. So, shout out to my students during that filming session. And of course, I want to give a major shout out to the American Association for Respiratory Care, the AARC, who provided the videos, the interviews of the various respiratory therapists. It's greatly appreciated for them for promoting respiratory therapy for education's sake. And so right now, we'd like to take any questions.